like, no, even if there was like only one of those movies. I still have your. I'm doing a good job at it.
So I can do yours. Secret life forever. This is Marie.
But in high school, I think my college was at the end.
We're in the same actors. You do pretty well. We didn't have our app now.
Okay, a couple of announcements. In addition to the fact that it's Stevie's birthday, of a lesser importance, there was a discovery of green mold on one of the cadavers, the last number 11, which you will all see when you walk into the lab. Well, you will not see. That's the whole point. This is apparently not good stuff, and it spreads like crazy in days. So what we would like you to, well, first of all, always make sure you spray down everything carefully, because there's some anti-mold stuff in the wetting solution. But everyone should open up the bag and check your cadavers to make sure that they're not turning green. Because if it starts there, it will be no time before your whole cadaver's green, and everything in the lab's green, and even some of them may turn green. You never know. It's not easy being green. Okay, so today's lecture is going to be mostly on Friday's material. So you started you obviously chopped off heads and looked at the back of the pharynx yesterday, and today you will continue to look at the pharynx, and you will bisect the head into right and left sides. And continue to look at the pharynx in cross-section. We will do the nose on Friday, so you can only do the pharyngeal part today. However, and on Friday, Dr. Cuisine from the dental school will be here talking about dental anesthesia. Same place, same time. But because he's talking about anesthesia on Friday, today's lecture will talk about the nasal region, which will be Friday's dissection. Okay, let's move along. Lights.
Dr. Flegel, does Friday count as lecture material, or is it like a guest speaker?
Oh, no, I think it's lecture material. It's only exams. Okay, this is what the head and neck, the area you're dissecting, is going to look like when you cut it in half. So many of these slides are going to be sort of figures to sort of give you some idea about how the pharynx works. Okay, so here's the nasal region cut in half. Here's the oral region cut in half, and here's the larynx cut in half, and the tongue, and everything below the cranial cavity. Okay. So if you morph that in, you'll find in your discussions, in the discussions of your book, there is a nasal cavity up here and an oral cavity down here, and this area in the back is the pharynx, This area in the front is the larynx, so this is the voice box. Okay, and oh, these little things are meant to be tonsils. These dotted things are meant to be sort of separations between different regions, and they can be separations of different types. Okay, here it is made to look more confusing. So here's the nasal cavity. Here's the hard palate. The eyes are up here. Piriform aperture, so when you breathe, air goes in through the nasal cavity, and when you look at the skulls, all these conchae and everything are in here. Okay, and then there's an opening between there and the upper part of the pharynx, part behind the nasal cavity, which is called the nasopharynx, quite appropriately. Just right at the edge here is the eustachian tube, indicated by that black dot, so that's that airway that connects the nasopharynx with the middle ear. And there's a couple of tonsils back up in here. This is the oral cavity. Okay, so the tongue's down here, the hard palate's up above. The mouth is the opening, so food or air come in here. Okay, then there are some sort of not really closed off areas normally, certainly when you're eating or breathing, but there are some what sort of structures that sort of occlude this area back here. And you'll see those in lab. And then sitting in this space here is the big tonsil that you're most familiar with, the one you can see when you open your mouth. The area behind the oral cavity is referred to as the oropharynx. Okay? Extending down here into the area behind, this is the larynx. Okay, so this larynx runs into the trachea. So when things are working normally, air can come in here and go into through the larynx to the trachea, to the lungs, bronchi and lungs, and so forth. Behind the larynx is the continuation of the pharynx. Okay, and then it is continuous completely with the esophagus down below, which, as you know, goes to the stomach. And there's a little opening here, a little thing called the epiglottis, which, when you're swallowing, can close over to make sure the food that comes in the oral cavity doesn't go down. Doesn't end up in your lungs. Okay, so this is sort of what these little diagrams are meant to show, how this whole area is divided up. So here's the more realistic structure. So here's the oral cavity up here, the nasal cavity up here, the area behind the nasal cavity is the nasopharynx. Behind the oral cavities, the oropharynx. The larynx is down here, and the area behind the larynx is the laryngopharynx. And as I say, this part continues into the esophagus. Okay, so air normally, food hopefully goes down to the esophagus. Air can come in, you can obviously be a nose breather or mouth breather or some combination, and air can come down here either through the nose, through the mouth, and ends up down here in the trachea, and so forth. Okay, here we are again. Here's a simulation. There goes the hamburger down the esophagus. And here's the air. Goes through either nasopharynx or nasal opening or the mouth into the nasopharynx and or oropharynx, and then down through the larynx. Okay, just to put the show in case you haven't figured this out by now. Oral cavity we'll talk about next week. Larynx we'll talk about probably next week, maybe the week after, I think next week. You've already talked about trachea and bronchi and lungs, and you've talked about esophagus and stomach and the rest of the digestive system. Today we're mainly talking, well, the nasal cavity is what we will deal with on Friday's dissection. But so today we're going to mainly talk about this area here, which you didn't get into. Once you saw the head in half, you will open up You've looked at the back part of it, but you'll see the structures in these areas and what the openings look like between the nasal cavity above into the nasopharynx to the oral cavity into the oropharynx. Okay, so let's start with the nose, which is, like I say, you will open up today, but Friday will be Friday's dissection. Okay, start on the outside. The nose does lots of things. Obviously, it's involved in olfaction. Although you recall the olfactory nerves, these filaments come through the cribriform plate up here, and actually the part that can detect smells or deal with the chemicals that we interpret as smells is only the upper part of the nasal cavity. And then there's respiration is important. You have all these conchae that you saw when we did the skull, and that's mainly the air passes through those conchae and going back. In doing so, the air is warmed if you're outside on a cold day. There are nose hairs, although there are appliances that can remove them, and they can filter out dust and dirt and things that you maybe don't want to end up in your nasal cavity. The nasal region obviously can warm the air that's coming in, and it can humidify the air that's coming in. As we'll see a little bit later, and you recall from our discussion of the skull, all these paranasal sinuses are opening into the nasal cavity in one way or the other, and they're constantly producing various secretions and mucus, and also the nasolacrimal duct from the eye goes into the nasal cavity. So the nasal region is also important for collecting structures from sinuses and tears from the orbit. And needless to say, that's what Kleenex are evolved for, to get rid of those secretions that you don't want clogging up your nasal region. Okay, the nose has an outside skeleton. Okay, the little thing that's poking out in front of your face, you're no doubt aware of that. It's a big business in reshaping these things. There are two bony parts, okay, two nasal bones, one on each side. Okay, they're separated in here between the two maxillae, and up here between the frontal bone. Okay, up at the top there's a lateral nasal cartilage, one on each side, and lower down there are alar cartilages, and then in the middle there's this septal cartilage, and the rest of this is softer tissue called fibroareolar tissue. But there's this bony structure up top, and then these cartilaginous structures that give the lower part of the nose its shape. Moving inside, here's the bony part, which again we sort of alluded to earlier in the bone lectures, skull lectures. So the nasal septum that separates the right and left sides of your nasal cavity is made up of three parts. At the top, there's an area known as the perpendicular plate of the ethmoid. All right, so your ethmoid bone is all in here. There's your little cribriform plate up there, Cristogalli. And then there's the vomer, which lies at the midline and is sitting on top of the maxilla here, or sitting on top of the premaxilla back there. And then the anterior part and sort of middle part that separates the right and left nasal cavities is known as the septal cartilage, or the nasal septal cartilage, or septal nasal cartilage. It's a cartilaginous structure. So there's a bone up here, but big bone down there, and cartilage in between. That's the midline. If you look on the sides, so extending from either side towards the midline, so we sort of, the septum is here, it's been ripped away, so we're looking into the right side of the right nasal cavity. There are again these bones that you're familiar with. The nasal bone sitting right up here at the top. There's the ethmoid up here, right? Again, your cribriform plate's back up in here. A little bit of lacrimal extending into here. And then the inferior nasal concha. You'll notice these upper nasal conchae are part of the ethmoid bone. The inferior nasal concha is a separate bone all by itself. Okay, and it's attached to the maxilla here. And then a little in the back, the posterior part over here is formed by the palatine bone. And then a little bit of lacrimal up front. And then in the back, there's the sphenoid with the sphenoid sinus and the sella turcica and the pterygoid plates. And here are the names again. Again, the superior and middle concha are part of the ethmoid. Inferior concha is attached to the maxilla, but it's not a separate bone. Here's the perpendicular, the palate. The back part is this palatine bone that we haven't seen much of. It has two parts. There's a part that forms the back of the hard palate, so it's a horizontal plate of the palatine. And then there's a vertical part, which forms the lateral wall of the nasal cavity. And that's the perpendicular plate. So the palatine is sort of L-shaped. And the stuff, as I mentioned earlier, the pterygoid plates, medial and lateral plates. And then up here is this opening between the upper part of the palatine bone and the anterior part of the sphenoid, which is the sphenopalatine foramen. And it, if you poke a pipe cleaner or something laterally through the sphenopalatine foramen, you're going to end up in the pterygopalatine fossa. And up here, you see this little gap there in the front of the sphenoid sinus. That's how the sphenoid sinus opens into the nasal cavity. So mucus and stuff from the sphenoid sinus can exit that way. And we'll go over how all these sinuses open in a few minutes. Okay. So we've talked about the structures. Well, when you have a row of structures, you have spaces between them. Okay? So this is your superior concha, middle concha, and inferior concha. The area below the inferior concha, between